The camera fades in on a wall of tabloid headlines. Wacko Jacko's new nose. His skin is melting. Singer becomes alien. Each clipping flashing for a fraction of a second, like the strobe lights of a paparazzi ambush. Then a different set of images appears. Hospital chart stamped confidential, dermatology close-ups under ultraviolet light, a slow-motion shot of third-degree burns blooming across a scalp during a Pepsi commercial in 1984. A voiceover cuts through the chaos. Between truth and rumor lies a space as narrow and as fragile as the cartilage of the human nose. That space became Michael Jackson's home address for nearly 3 decades. To the outside world, his face was a canvas of supposedly endless operations, a freak show timeline of chins, cheeks, and skin tones. Yet beneath that spectacle lived an actual medical record. Rhinoplasties to correct a deviated septum that threatened his breath control, steroid injections for allowed but fading scars, decades of treatment for vitiligo, an autoimmune disease that strips pigment from the skin, and whispers of discoid lupus, another autoimmune disorder quietly gnawing at his dermis. The public rarely saw those charts. Instead, they saw renegade surgeons and exaggerated whitewashing conspiracies, all wrapped in headlines designed to sell 50-cent papers and 30-second ads. And so the myth metastasized, that Michael Jackson changed his race, that he rebuilt his face monthly like a Lego set, that he slept in pressurized oxygen chambers to halt aging, that he replaced his nose entirely with a silicone prosthesis that could fall off mid-concert. Most of it was fiction. Some of it was half-truth seasoned with one clinical fact. All of it made money for someone other than Michael. Tonight we peel away each rumor like a surgeon lifting gauze from fresh sutures. We begin with a high school broken nose repaired in 1979, move to the pyrotechnic disaster that fused his scalp, tunnel through TV interviews where Oprah and Diane Sawyer asked questions dermatologists should have answered, and end at the autopsy table where a coroner finally documented reality, vein by vein, graft by graft. Along the way, we ask a harder question. Why did a black performer's medical journey become the most sensationalized body narrative in pop culture history? Was it Michael's own stagecraft that invited the scrutiny, or a media machine trained to distort every mirror until the reflection looked monstrous? The answers are complicated, technical, and painfully human. If you've ever shared a meme of No-Nose Jackson, or wondered why his skin appeared porcelain while his siblings remained brown, or repeated the Barstool claim that he had over 100 surgeries, this film is for you. Set aside the jokes for 40 minutes. Let science and primary documents speak. Let surgeons on record speak, and most uncomfortable of all, let Michael Jackson himself speak in depositions and taped consultations he never intended the public to hear. This is not a defense piece, nor a prosecution. It is an autopsy of rumor. And when you finish watching, you may find Michael's face was never truly the mask. Ours was. We wore it every time we chose spectacle over evidence, sensation over empathy. Fade to black, the investigation begins. Rewind to Gary, Indiana, 1967. 11-year-old Michael steps onto a makeshift stage in a Rust Belt gymnasium, belting out a Smokey Robinson cover while doing spins dangerous for a child his size. During one rehearsal, he collides with a microphone stand and fractures the bridge of his nose. No doctor sets it properly. Touring schedules leave little room for pediatric orthopedics. That childhood fracture will reappear 12 years later, like a ghost demanding attention. Fast forward to 1979's Destiny Tour. He's 21, fresh off the wall with a solo album in Billboard's top 10, but his breathing feels off. In studio takes, he labors on sustained vowels, the nasal cavity whistles. Enter Dr. Stephen Hufflin, a quiet Los Angeles plastic surgeon known for repairing congenital clefts in children and occasionally the noses of celebrities whose livelihoods depend on unblocked airways. Jackson's first rhinoplasty is performed under medical necessity to straighten a deviated septum, remove residual cartilage fragments, and open a partially collapsed valve. Anesthesiology notes list functional correction as the primary indication. The surgery is modest by entertainment industry standards. Fans hardly notice, but critics do. Rolling Stone prints a sidebar. Is the baby-faced wonder becoming Hollywood? A tiny sneer, yet enough to plant the thesis that Michael equates artistic rebirth with facial replacement. That narrative gains traction the moment Off the Wall sells 20 million copies and he becomes, unmistakably, the first black megastar of the music video age. Television thrives on close-ups. The smallest contour shift becomes an 18-point font. Then comes 1984, January 27th, Shrine Auditorium, Los Angeles, Pepsi commercial shoot. 2 faulty pyrotechnic canisters erupt milliseconds early, spraying Michael's scalp with fire. Third-degree burns char skin to the bone in a quarter-sized circle at the crown. Second-degree burns ripple outward like an expanding sunspot. Hospital charts record sulfur powder plus heparin cream, donor graft from posterior thigh, pain management Demerol at 50 mg every 4 hours. This single event detonates more appearance-related complications than any amount of voluntary surgery. Scar tissue tightens, hair cannot take root, migraines become chronic, and bald patches must be masked by hair pieces painstakingly woven into fragile new skin. Insurance settlements with Pepsi cover treatment but not the psychological toll. Michael buries himself in studio work for what will become bad. Meanwhile, tabloids discover the term vitiligo in preliminary dermatology filings and misreport it as a cover story for bleaching creme addiction. In reality, Jackson is diagnosed that same year by Dr. Arnold Klein and confirmed later by UCLA immunologists. Vitiligo vulgaris with segmental presentation favoring face, neck, and chest. Phototherapy with Psoralen UVA is prescribed, along with hydroquinone creams not to lighten healthy skin, but to even out already pigment-stripped areas that looked patchy under stage lights. On darker skin, such depigmentation is visually dramatic. Critics call it vanity. The medical file calls it camouflage against autoimmune chaos. All this nuance evaporates in the tabloid press. The Inquirer prints, Michael to turn himself white by 88, ignoring that half the pigmentation battle is out of his control. Dermatology professors issue quiet corrections. Few papers bother reprinting them. And so block by block, rumor outruns pathology. By the time Bad's cover photo is released, sharp jawline, narrower nose, jerry-curled hair concealing graft scars, millions believe they are witnessing elective metamorphosis, not therapeutic maintenance after burns and disease. The myth is only beginning. The late 80s usher in partial truth, total spectacle. Michael undergoes a second rhinoplasty, confirmed by Dr. Hufflin and later by forensic reports, primarily to refine asymmetry left by swelling from the first surgery and the persistent cartilage damage from youth. Cartilage memory is tricky. It warps as scar tissue matures, requiring incremental corrections. Surgeons compare it to tuning a Stradivarius where the wood never stops expanding. Yet TV comedians reduce this micro-adjustment to endless punchlines, stitching it into a running gag that his nose falls off if he sneezes. Around the same time, Jackson starts experimenting with a cleft in his chin, a tiny dermal implant meant to sharpen a naturally soft jawline. Photographs reveal the change only under certain lighting. Ironically, more people notice after tabloids circle and enlarge the feature. Each highlighted pixel becomes a courtroom exhibit in the public trial of his face. Then, in 1993, Oprah Winfrey's primetime interview occurs. 90 million viewers watch Michael confess 2 surgeries on his nose and nothing more, a claim immediately contested by plastic surgery guilds eager for airtime. The press brands him a liar. overlooking that rhinoplasty and chin augmentation often fall under the same procedural code in older medical billing, which might explain his semantic shorthand. Simultaneously, the real bombshell, vitiligo confirmation, is overshadowed by the spectacle of Oprah rubbing his hand to show color contrast, as if the world needed proof his melanin was fading. Science again becomes sideshow. The lupus angle enters next. Physician-patient privilege limits what can be verified, but autopsy micrographs later reveal discoid lesions on the scalp, consistent with lupus erythematosus. Lupus can thin facial skin, making cartilage edges more visible, accelerating appearance changes independent of surgery. That nuance is too intricate for tabloids. Easier to write, he can't stop cutting his face. Headlines roar, nuance whispers. 1995's history. Promotional blitz shows a sharper jaw and more angular cheeks, prompting cheek implant speculation. Surgeons familiar with long-term steroid use, remember the scalp injections for burns, know that localized cortisol can atrophy fat pads, hollowing out cheeks over time. Again, medical probability loses to scandal potential. As lawsuits mount, Chandler and Francia allegations both unrelated to appearance, Jackson's legal team advises him to avoid depositions that could open medical records to public cross-examination. The press equates confidentiality with guilt, conflating cosmetic secrecy with criminal concealment. Meanwhile, paparazzi zoom lenses to 400mm, producing grainy images where compression artifacts mimic surgical scars. Those blurry pixels go viral as evidence of latest procedure, while raw high-resolution photos, which reveal normal pores and no fresh incisions, remain unprinted. By decade's end, Jackson relocates to Neverland, builds a private clinic wing inside the ranch, and travels with his dermatologist on tour, not for vanity but to manage daily UV-sensitive vitiligo skin. Insurance forms reveal phototherapy lamps installed near dressing rooms. Tabloids call them skin bleaching chambers. The gap between medical code and headline copy widens into a chasm, and society gladly jumps in. The 2000s begin under new spotlights, high-definition TV and the internet's rumor wildfire. HD cameras exaggerate every pore. Fans freeze-frame screenshots to dissect nose contours. Message boards claim cartilage collapse. Surgeons note a common aging effect called alar retraction, seen in many rhinoplasty patients after 15-20 years. Michael, now in his mid-40s, tries nasal splints at night to slow the process. One leaked photo of the splint sparks the urban legend of a detachable prosthetic. Around the same period, he experiments with tape on the nose bridge to reduce stage-like glare and secure HD microphone loops. Tabloids publish the tape as nose patch hiding open wound, fueling new Frankenstein fantasies. They ignore that other artists, from Beyoncé to Broadway performers, use similar tape for sweat absorption. Michael is simply better copy. Pain management becomes another flashpoint. The 1984 burns left nerve clusters hypersensitive. Scalp expander surgeries in 1993, attempts to regrow hair over bald grafts, fail, leaving chronic neuropathic pain. Physicians introduced Demerol, later morphine, and eventually propofol as a sleep aid when insomnia worsens on tour. Press coverage reframes a documented iatrogenic dependency as drug-fueled self-mutilation. Each hospital visit for sleep therapy is photographed through telephoto lenses. A single oxygen mask image becomes proof of monstrous elective surgeries. 2003's Bashir documentary pours gasoline on the fire. British journalist Martin Bashir asks, "How much plastic surgery have you had?" Michael, visibly uncomfortable, repeats the two-nose job answer. Editors intercut the denial with zoom-ins of his face, implying deception. Bashir omits a filmed segment where Jackson's dermatologist explains vitiligo and lupus in detail. footage later revealed in the rebuttal film, but mysteriously absent from the BBC cut. The omission is journalistic malpractice, yet the damage sticks. Ratings beat the Grammys that year. By 2005's criminal trial, prosecutors tried to subpoena entire medical archives, arguing that pain medications might impair Michael's credibility. Defense attorneys counter that scalp and skin records are irrelevant to molestation charges. The judge agrees. Nonetheless, paparazzi stake out UCLA Medical Center hoping to catch post-operative bandage photos. One intern leaks a shot of Jackson in a surgical mask leaving an allergy clinic. Tabloids call it face falling apart. After acquittal, Michael relocates to Bahrain, then Ireland, then Las Vegas, chasing both security and experimental depigmentation treatments that promise smoother vitiligo blending. The treatments involve melanocyte-stimulating factors, not bleaching, but bloggers twist it into final full-body whitening. Ironically, the vitiligo has by now depigmented 80% of his torso. Blending cream merely harmonizes remaining spots. He is no longer on stage selling records, yet the circus follows, cannibalizing relevance from a face it helped distort. Then comes 2009. This Is It rehearsals push Michael S. sleep cycle to a cliff's edge. Dr. Conrad Murray administers propofol at home, illegal outside a hospital, to induce rest. The drug is an anesthetic, not cosmetic, but tabloid shorthand becomes plastic surgery killer. When Michael dies on June 25th, rumors spike that failed facial operations compromised his airway. Autopsy results contradict that. Airway clear, nasal passages open, no foreign implants, no silicone prosthesis. Pathologists list only 2 rhinoplasties and a small chin implant, plus health-related dermatologic procedures, not the hypothesized dozens of cosmetic overhauls. Final irony, in Death Medical Truth is published for free, but few tabloids print retractions. What remains is legacy and collective responsibility. Michael Jackson's face became a mirror for society's obsessions, racial anxiety, fear of aging, distrust of medical ambiguity. Surgeons who did treat him describe a polite, research-oriented patient, obsessed not with narcissistic reinvention, but with breathing capacity, scar camouflage, and minimizing vitiligo contrast under 5,000-watt stage lights. Dermatologists describe a textbook autoimmune case compounded by third-degree burns and steroid after effects. Yet the public preferred the carnival poster. Man turns himself into ghost. Academic studies now cite Jackson's media coverage as a case study in racialized medical stigma. Headlines about his changing skin rarely mentioned vitiligo by name, despite millions worldwide sharing the condition. Those patients report increased bullying post-White Michael memes, proof that stigma does not stop at celebrity gates. Likewise, coverage of his supposed ever-shrinking nose fed stereotypes that black features are undesirable, reinforcing colorism he fought in philanthropic work. On the plastic surgery front, Jackson inadvertently advanced medical practice. His scalp graft issues spurred research into follicular unit transplantation. His need for breathable stage masks led to lighter hypoallergenic adhesives now standard in burn clinics. None of these contributions made headlines. Scandal did. Today, digital forensics can overlay 3D scans of Jackson A.S. 2009 skull with 1980 X-rays and confirm minimal structural change. Trimmed nasal bone, narrowed alar base, modest chin cleft. Software renders the cartilage shifts in millimeters, not centimeters. The nose job every month narrative required anatomical impossibilities. Cartilage can't survive infinite carving. Modern audiences finally see the math doesn't add up. A TikTok trend even compares before and after without sensational captions, letting viewers conclude the difference is far smaller than legend states. Yet myth lingers. Why? Because spectacle sells faster than nuance. A dermatologist explaining melanocytes won't trend. A photoshopped nose collapse will. The onus now shifts to storytellers, documentarians, YouTubers, even casual social media users, to decide whether repeating falsehoods is worth the clicks. Michael's autopsy is public record. His depositions are accessible. Peer-reviewed vitiligo studies exist. The truth is no longer hidden, merely outgunned by louder lies. In the end, Michael Jackson's real tragedy might not be the surgeries he had or didn't have, but the ones the press performed on his image, cutting away context, grafting rumor, injecting fear, until the public could no longer recognize the original tissue of a shy kid from Gary who just wanted to sing. Perhaps the fairest reconstruction we can offer now is intellectual. Sew the facts back together, cauterize the speculation, and let the scar of our collective error remind us how easily a face becomes a funhouse mirror. So the next time someone jokes that Michael turned himself white, ask them if they can pronounce autoimmune hypopigmentation. If they laugh about noses falling off, drop the autopsy PDF in their inbox. The anatomy of rumor only heals when confronted with evidence. We owe that to Michael Jackson, to every burned patient who hides under wigs, to every vitiligo teen who scrubs its stains that will never come off because they aren't tea stains at all. Fade in on a final image. The 2009 Staples Center rehearsal. Michael, silhouette under blue gel lights, leans into human nature. He's 50, exhausted, but the voice sails. The camera zooms past his face, past the nose that launched 1,000 lies, and lands on his closed eyes, sweating but serene. In that moment, the features vanish and only the music remains. Maybe that, after all, was the real face he wanted the world to see. Cue end credits.